Yeah. So it says your current research interests are health equity, cultural aspects of care, pediatric, palliative care. I probably said that wrong, and improving health outcomes experience. Can you like focus on one of those and why you're interested in it? What drives you to pick that certain research topic?
So I mean, I mean, just lots of things, but I specifically want to help like underserved people, people who haven't had a seat at the table, people who look like me, people who have had poor healthcare experiences. I've had poor healthcare experiences, and being like the person in the medical field in my family, my husband's family, I go to a lot of, you know, um, when people are in the hospital or people have questions about appointments, I use my education and the resources and things that I've studied so that I can help them, right? And so, um, you know, part of the reason I did go back to school was that, I can give statistics, I can write papers, I can complain, I can talk to my peer group that have also had poor experiences, but I want to be part of the solution too. And so, I'm very fortunate that I had the opportunity to be able to go back to school. I know that I have privilege, right? Even though, being a black woman in America, there's lots of not privileges. But I also was in a position that I was able to go back to school and pursue a doctorate degree and be the, first one in my family. So I don't take that lightly at all. And so, like I said, want to be part of the solution. So I was like, you know what? I have the opportunity to go back to school and be a provider myself and be part of that change that I want to see. And, I know that part of that is, um, I like patient care, um, helping people on the individual level, but also having a doctorate degree gives me a little bit more oomph when I want to help get legislation passed to help, improve the healthcare system and improve health outcomes and things like that. And so, um, yeah, I wanna, like, help people, like I said, I try not to gatekeep information, I do have my little blog that I've been putting health information and stuff as I'm able, because again, time is limited, but, I can't tell you, like, even in the last couple months, I have helped, and I'm not saying that I'm not a, like, braggy person, it's just, like, I have helped people with trying to find caregivers for, a family member with dementia. I've helped um, answer questions about a diagnosis. I've helped, and this is like friends and families that have my number that call me up and, ask about their kid's medical condition. And not that I'm the expert or the guru, and I'll even tell them like, hey, you need to go to the doctor, right? And that's my answer. But I can also help translate stuff because I have that education and experience that when I hear certain buzzwords, I say, "Oh, don't say that. Like, you need to say it this way," right? Because if you say that, they're gonna be being in the medical profession, I can translate and say, "They're gonna hear it this way, and that's not what you mean," right? And so I feel very fortunate that I'm in that role, to be able to be that person, and like I said, be part of the change that I wanna see.
And so you said you were born in Tacoma, right?
Yeah.
So you go